So I'm doing rewires today, and Savvy had transferred to my practice from another clinic using twin brackets. And if you look where Savvy started, he had a very narrow jaw and a rotated premolar in standing 5, just a frontal photo. And centerline was out because of the in-standing tooth. Plus we had a traumatic edge-to-edge bite with a bilateral posterior crossbite, right? So just to show you the benefit of Damon mechanics, if you just open again there for me. So we rotated the 5 using the ANG technique, A-N-G, which is the core spring to the rotated tooth. And we used Damon with opening coil to make room for the lateral. And then if you look closely, the lateral has been inverted so that the torque has changed. So 1, 2 has been brought into position correctly with night eye opening coil and reverse torque. Now we're at the stage where we're correcting the class 3. Now to correct the class 3 non-surgically, we place anchor points, and you can see here these are called TADs, and we're using the John Lynn technique. So the TADs with class 1 pull will bring all the lower teeth 7 to 7 back to correct the overbite. Just open again for me, thank you. In the upper arch, because it's narrow, we're using buttons on the 6s with elastics. But rather than cross elastics, the tip here, because it's a low angle case and class 3, the elastic will go from the hook, the button on the upper 6 down, but together, to the hook on the lower 3, and that hook on the lower 3 is because we're in a lighter wire, so we're under tying. When you get to a rectangular wire, put a post on the wire or use the pre-posted wire. So the tip here is class 3 long elastics with a transverse component. So elastics from the inside of the upper 6s to the outside of the lower 3s, and that will give us expansion, class 3 component, and help with the bite opening mechanics. So John Lynn technique, class 1 pull for the lower. We're using a class 3 elastic also, and the goal is to get the entire lower jaw back behind the upper incisors, get the width of the upper jaw to match lower, then we have a good class 1 occlusion. So a couple of tips just to show you. Very hard to slide with twin brackets. As soon as we took the twins off, we went to Damon, we got the room amazing. A lot of people, just the upper arch, a lot of people would look at that and say, well, there's no room, it's an adult, so they would take out premolars. No need to if you use light forces. In the lower arch, again, look at all that crowding. And a lot of people would say, well, you'd have to extract there because of the class 3. And in theory, you could take out one lower incisor, but patients need to be given options. Now, if you look at the update photos, you can see how quickly that's lined up with Damon. And if you look at the upper occlusal, you can see the beautiful Damon arch form. But because of the big mandible, we're using the cross class 3 elastics. And our goal to finish is really now just to get the center lines on and get the transverse of the upper and the lower back, and then we can go into our retainers. That is the Chris Chang bone screw. It's called an OBS. And it's a very good bone screw for the John Lynn technique, because you can put power chain, night eye closing coil, whatever, because of their head on that position. Okay.